Tamara, welcome to our podcast of the G20 G7 Health and Development Partnership. We are very excited to finally get to interview you. And for everyone, of course, who will watch this, Tamara is the Vice President and Head of Global Access and Policy at Roche, and has been with us in this journey for some years now. So Tamara, I hand over to you. Please introduce yourself to the crowd before we kick off.
Thank you, Hatice. It's a pleasure to start 2025 with you, and happy to be here today. So as you mentioned, I am Tamara Schudel. I work as Vice President and Head of Global Policy at Roche, based in Basel, Switzerland. I've been in the industry for almost 2 decades, working in global health access and policy, and I would say it's a true passion of mine. It's a pleasure to go to work every day, not only working with my team at Roche, but also with partnerships and colleagues such as yourself and the platform, which we're going to be discussing today.
Perfect. Thank you so much, Tamara. I mean, wow, what a year to start, right? We've been following a lot of the recent geopolitical events. Health is, from my perspective, we have to advocate more this year and then in the next 3 years, to be honest, than ever. The geopolitical shift, commitments in global health have changed. How do we keep it high on the agenda? Pandemic obviously has eased out, but another pandemic is on the line. So we have lots and lots to discuss about. And when I think of the World Economic Forum, Tamara, the main theme was public trust. And we were talking with colleagues the other day. I mean, public trust in global health has evaded as well. So what I would like to kick off with you are these many challenges now that we're facing in the next 3 years, of obviously looking at the G20 as well. But before I go into the depth of everything, what do you think now are the global challenges we are actually facing now, and also, let's say, until 2030? What's your perspective?
Well, I mean, you mentioned a lot of it already. The world is facing immense challenges on every front, and it's really across economies, geographies. So if you're a policymaker sitting in a country, you're grappling with a lot, from stagnant economic growth to geopolitical conflicts to energy security and climate crisis issues. And then you have to see, well, what's happening in the health landscape. And if we look at health alone, the growing burden of chronic diseases is on the rise everywhere. And if we just look at these non-communicable diseases, which include things like diabetes and cardiovascular health and cancer, they alone account for over 70% of all deaths worldwide. And that means 41 million people annually are impacted by these diseases. So imagine what that means for health systems and economies that have to manage this. And that's, of course, compounded with an aging population. On top of these chronic conditions, which are present everywhere in the globe, we do still have disease outbreaks from infectious diseases such as the Marburg virus or influenza or Mpox. We also know we have gaps in pandemic preparedness, and we see a rise of antimicrobial resistance. And that alone, if left untreated, would lead to 10 million deaths per year by 2050. So if you're looking at it from a policymaker perspective, there are a lot of challenges compounding the health system and budgets. And these challenges in health are often perceived as a cost, as a drain to budgets. They're not viewed as a driver of economic growth if they are contained and managed properly. So we have to be better at telling that story, making those links, making sure we're collecting the right evidence. And that's what gives me optimism, because health is not in a silo. It is connected very deeply with economic growth. It's connected to environmental sustainability and also societal equity. So if we can be together, united in our evidence, in our messaging, in our solutions, then this gives me hope that we can address as a global community the rising challenges of health and complement that to everything else governments have to deal with.
Yeah, and a good point you raised is if we tackle these challenges together. So it is still, I think, to your point, our job to bring in not only the health and finance minister, but finally bring in the agriculture minister more into the mix, the education minister, environment minister. There's so much more, I think, that you kindly outlined. But you mentioned, of course, the NCD challenge, so the famous non-communicable diseases, cardiovascular diseases that include diabetes, heart disease. So if you look at those, what's your suggestion? How can we really tackle these challenges? Like, do you have some practical examples or solutions you could provide?
I mean, there is no magic bullet, just the nature of diseases, they are so complex, but there are things we can be doing. One, we need to recognize that health is really foundational to societal progress. So if we're looking at health as means to a healthy society and strong economic growth, this already should be hopefully shifting perspectives on the fact that we need to control the outbreak and the rise of non-communicable diseases. There are different things we can be focusing on. For me, looking at the current challenges and how we haven't progressed with our commitments on NCDs, it comes down to really resourcing and financing. We can have the best policy solutions, we can have all the brilliant targets, and we can have passion and commitment. If we're not putting resources and financing behind it, they're theory. They're not making any real progress on the ground. They're not benefiting patients. So one is really looking at what are those different, innovative, better, flexible, sustainable funding and financing mechanism that we can bring into the space. Who can play what role? Holders, we all have a role to play. And I think making sure we're committing enough resourcing to address the challenge is going to be the first thing. The other thing is being smart about the money we invest. So we know there's plenty of data and evidence that says if you can prevent a disease from happening, this is not only better for the patient and their outcomes and the health system, but it's also better for your limited budget. If you can catch the disease early, so if you're screening and you're catching it at the beginning, especially in chronic conditions like multiple sclerosis or cancer or any, you name it, if you catch it early, the outcomes of the patient are much better. That patient can go back to work. They can be an active member of society. If they have small children or elderly parents, they can continue being the caretakers. And the investment you made into that patient goes a lot further. So your budget is used in a better way. So I think there's different elements. Instead of prolonging the problem and waiting till it's too late to throw money at it and we don't lead to good outcomes, we need to really start thinking about it as early as possible. And then making sure we're looking at this in an integrated way, that we have a healthcare workforce that can look at the patient as a whole, that they're trained and upskilled properly, that we're not looking at you as, a diabetic or someone with cancer, but really looking at the whole of the patient and catching things early and connecting the dots at the right point of time is going to be needed. And the power of technology and AI and data here is another thing that gives me optimism, because the more we know and the better tools we can leverage, we can actually have meaningful progress to achieve the goals we've set out for ourselves.
Yeah, that's, you mentioned three critical points for me here. The cost of not investing into health or not smart investing will be more outrageous than vice versa. So the other point you mentioned, which is onto the point, is not just talking about disease silos. We can talk about diabetes, mental health, cancer, and so forth. But actually, when you talk about prevention, how do we invest into the right health workforce? How do we train them? And how do we teach them to test, to treat, for example, as well? These are components with obviously the global challenges and globalization moving forward that I think is not on the radar of G20 leaders. And it's not only about the disease or the challenge or the threat, it's actually about education and training as well. And I think, thank you for raising that point. And lastly, of course, AI. These days, with the stock markets shaking up this week, is usually seen as a challenge, Tamara. But in the health industry, I think AI is the best prime example that can be used to, advance innovation. So it's a very good story we can tell by better harnessing AI, as opposed to some other industries. And I think we need to just voice that a bit more, as you nicely outlined. And if you now think of course, we're the G20 Health and Development Partnership, and we have the UN high-level meeting on NCDs coming up this year. but also we have, of course, the presidency in South Africa, the G20 presidency. With South Africa's G20 presidency, Tamara, the Global South is finishing their term. So in the last 3 years, as you know, it was the Global South. So when you look at South Africa in the G20, when you look at Canada in the G7, what do you think can they do as a joint effort or in their own presidencies, and including the UN high-level meeting to tackle or to raise awareness on NCDs or other challenges that you raised?
That's right. I mean, it's an important year in a sense that it gives us another key milestone, especially when it comes to non-communicable diseases. And that's with the approaching high-level meeting of the UN on non-communicable diseases. It's the 4th time this meeting is happening, which means 3 times before, the world leaders have gathered at the UN to really talk about this issue of how do we tackle non-communicable diseases, and targets and commitments have been set. What we've seen in the past decade, we haven't progressed towards those targets as we had intended. And a huge part of that, again, is a lack of resourcing and funding to actually systematically address the problem. Yes, it's expensive, and yes, it's complex, but it is cheaper to address it at the forefront, as we said, than let the problem escalate further. So we have a commitment at a global level and another opportunity this year to really come together and put down some pragmatic commitments and solutions. And this is where platforms like G7 and G20 play a critical role in my perspective. These are some of the strongest economies. So if they can align their health commitment interests, their health system strengthening interests, if they can align their political capital and their economic capital around driving in one direction to address these commitments, this is what we need. This is unstoppable. And if we do believe and we can advocate that healthy populations are the bedrock of growing economies, this is at the heart of what the G7 and G20 look to. How do we make sure we have strong economic cooperation, strong economic growth, and health needs to be at the center? And what we've seen, because of all the global health challenges, health gets downplayed because, again, it's looked at as a cost line, a cost center. So we need to be shifting those perspectives, and no one stakeholder can do it alone. And this is what excites me about the partnership, that we come from different angles of health and we provide solutions, and we provide the data and the evidence and the advocacy platforms like G7 and G20 need to consider. So they can unite in their commitments, their political capital, their economic power to drive health progress. This is the linchpin to actually start moving the needle in the right way. And also, these countries, a lot of these countries host a lot of the industries, the life sciences innovation that comes. So they really need to be thinking about this holistically. What does it mean for future innovation? How do we make sure we continue to have a flow of innovation, that we can be better prepared for the next pandemic, that we can curtail the negative health trends we're seeing? So it is all interconnected. And if they can, align to one set of commitments that we can drive sustainably forward, so it's not year over year changing, this would be amazing.
Thank you. That is definitely the right path forward. I fully agree with you. And as you nicely outlined, so in our partnership, that's exactly what we do. So we have the group of parliamentarians, we have industry representatives, which you belong to, we have NGO representatives, academia, everyone is in the group. And we all agree that we also disagree, but we still can make joint recommendations. So with that in mind, and what you nicely just outlined, what do you think can we do in this partnership, with obviously also your role as a global ambassador, concretely in the next few months, also thinking of our Health 20 Summit coming up at the WHO? How can we contribute concretely to these discussions and make G7, G20 leaders a bit more focused from our operational point of view? What's your perspective?
Yeah, well, I mean, that I believe that the partnership is such a powerful platform, which is why I'm proud and humbled to serve as a global ambassador. And I will always dedicate my time to the cause, because I do see it being as a key catalyst to driving meaningful action on G7 and G20 platforms when it comes to health. I think one of the critical things we need to be doing collectively is generating the right evidence and singing from the same song sheet. One of the challenges the partnerships has, there's a lot of issues to tackle. There's a lot of passion and excitement around what needs to be done, but it can be overwhelming. So if we can focus, what are the top 3 things we want to drive forward? And if we were to achieve those, it would trickle down to all the other things that we want to manage. I think that would already be amazing. So as we anticipate the Canadian presidency at the G7, as we anticipate a change at the G20, as we look to the UN high-level meeting on NCDs later in the year, if we can really coalesce around core evidence and key messaging, which we all go out and we are all advocates. It doesn't matter if you're an ambassador officially or not. Whoever is in the partnership has a role to play to drive meaningful messages forward, to drive meaningful action that can lead to commitment and something pragmatic on the ground. This is for me, the essential role that the partnership plays is really catalyzing all these different components and bringing everybody to the table. And that's been the amazing achievement that I feel this platform has been able to create.
No, thank you for your kind words, first of all. We love to hear that. But as you nicely said, so focus, pick your main messages and also relate that to the G20 or G7 audience. As you said, we are aspirational in our messages. We want to get policy moving. We're living and breathing policy in this partnership, but we also have to be aware of realpolitik. And some messages may not get across because of so many different competing priorities in the global space right now. And as you also said, we don't just talk, we do, and we have people who do and do not just talk. And we are so proud to have global ambassadors like yourselves, Tamara. And thank you for your powerful messages today. I think we came to the end of the little podcast that we have. But I would love to thank you, and people who will watch this will see there will be more to come from you and from the partnership this year. Do you have any final message to share with us before we say goodbye?
Well, just a huge thank you again to you and the team for all that you do. It is a critical year. Health is going to be definitely not at the center of a lot of the global discussions. And I feel with the partnership we have, we really can cut through the noise and make sure we're positioning health to all the other priorities governments care about, that it's not taken for granted, and that we just continue to stay on course, because we know it's a long-term aspiration and it's not going to happen in 1 year. But this year will be critical, and I look forward to working with you and the team and other partners to drive forward meaningful progress.
Thank you so much, Tamara, for these powerful words and your time. And we hope to see you soon. Thank you so much.
Thank you. Bye.